Good morning, everybody. Welcome to Indiana SHIP's Facebook Live Medicare Monday. I'm Susan with SHIP, and I am joined by a whole bunch of terrific people. As usual, my co-hostess Megan Rogers is on with us, and I'm going to introduce my first coworker, Sean Swindell. Sean is the volunteer supervisor for Eastern Indiana, and she has invited some extra special guests. Sean, good morning.
Good morning. How everybody okay today?
Yep.
Good. Good. I have my special guest today, Nancy Lewis, a SHIP counselor from East Central Indiana, Henry County. Good morning, Nancy, and thank you so much for joining us.
Oh, you're welcome, Sean. Good morning.
Nancy, have you been a SHIP counselor like 4 years now?
I think 4 years, yeah.
About 4 years. Tell us a little bit about your background and how did you get into SHIP counseling?
Okay, well, I'm now a retired nurse, but at the time I worked at a not-for-profit Indiana community action program, and I worked with some insurance like Medicaid, things like that, and a lot of uninsured clients through the WIC program and through we had a clinic for uninsured people. So then I got older and I also went through the Medicare process with my husband and realized, just how difficult it is for people, young and old, to go through that process.
Okay.
So when I retired, there was no SHIP counselor in our area any longer.
Okay.
And I don't know how I met Sean, but anyway, I decided, that might be something I should pursue just to help my friends and family. And then it's kind of blossomed from there to the whole
Right.
community. So.
Yeah, we kind of met over through the ICAP programs and that Henry County Community Health Resource Fair,
Right.
Because Nancy has some involvement too with other network just programs and nonprofits. She's involved in the cancer, like a foundation or something. Is that right?
I'm involved with it. Well, I got worried when I retired I wouldn't have anything to do, which was crazy. So I over volunteer. But I'm with the Henry County Community Foundation. I'm on their board. I am on the board of the Henry County Cancer Society and Safe at Home, which is a domestic violence shelter here. But I've been with them like 12 years. So yeah, I
Yeah.
kind of keep myself busy and SHIP.
Yes.
So
And we appreciate you here at SHIP. And Nancy is one of the SHIP counselors. And you know how we all get those very complex cases? Like Nancy really gets some doozies once in a while. She really does. And you guys, Susan and Megan, you guys all might remember last year during open enrollment in our area, we had a big deal with the city of Newcastle made some changes to the retirement program. And so Nancy really helped pull through for that because we were able to meet with people and to coordinate in addition to our regular clients who would be coming to see us during open enrollment. Then we had the city of Newcastle retirees also. And that created a jam in our schedules. And so Nancy kind of stepped up and coordinated some meetings and presentations at the community foundation. And then we were able to help a lot of those city folks as well that had questions in addition to retirees. So Nancy, all your work and efforts for Medicare beneficiaries does not go unnoticed. We at SHIP really appreciate you and everything you do.
well, thank you. But Sean, you're always there because Sean's on speed dial for me because I do. I don't know. I don't know how I attract some of these things, but we do have some very unusual.
Well, don't put me on speed dial for any medical
I will.
treatment of any sort. I am not
No,
that
but
person. I can't do
I
that.
appreciate your knowledge because you're very knowledgeable and helped me get through quite a few things. But
Thank you.
yeah, I don't want to go through what we went through last year. So hopefully they won't make too many changes to retirees.
I hope not. Thank you, everybody. And thanks everyone else for being here today. Nancy and I appreciate everybody.
Yep. It's been fun. So.
Thank you, gals. And if you haven't caught on what the topic for today is. We're showing some love to our counselors. Probably should have mentioned that at the beginning. But we love all of our counselors and we appreciate their time extra, especially this morning for joining us on our Facebook Live. So, Donna, would you like to introduce us to your counselor and
Yes.
your job at SHIP?
All right. I'm Donna Vincent. I'm actually the volunteer supervisor for the Southeast Indiana. And I have Kim Wilkinson, who is from Harrison County Community Services. And I guess we were later discussed about being partners in crime, I think that probably summarizes Kim and I on that one. Kim actually is a SHIP counselor at Harrison County Community Services in Corden. So, Kim, I will kind of let you take it over. You've been with us, what, 14 years now?
14 years on Friday.
Yes.
Yep.
So you're a long timer.
I am. I told somebody the other day, I'm 57, not to give away my age, but I intend to do this for a long time because I do enjoy helping people. But so yeah, I've been a SHIP counselor for 14 years. I started SHIP counseling because it was part of my job description. When I was hired, the person who'd been doing SHIP counseling here retired, and so they needed somebody to fill the spot. So I've never looked back. I enjoy it. Even the tough days make me smile somehow just by helping people. So.
All right. And tell me if I know you have quite a few stories, but what are some of your biggest and your most rewarding stories?
So one of the things that I've told you that I love about SHIP counseling is that if I can save someone on Social Security money by either helping apply for a Medicare savings program or just finding a Part D that saves them enough money that maybe things aren't so tight anymore. I enjoy doing that. I enjoy taking on challenging cases. Nancy and I are probably, I don't know, we might have to share some war stories at some point because sometimes I think that the challenging cases just kind of magnet to me, but I enjoy helping straighten out, I have said rumors. So I had somebody call me and say that the Social Security had told them that they were going to lose all of their money because their spouse was in the nursing home. And so because of my SHIP training, I knew about the spousal impoverishment program. And while I couldn't advise her fully, I could tell her who she needed to talk to. So that was very satisfying because you don't always hear back from people. But in her case, less than 6 weeks later, she called and thanked me for guiding her in the right place. I didn't give her the answers. I just told her where to go. And she was able to keep more of the income than she had ever imagined. It was enough to keep her there. Challenging cases again are my thing. And a couple of years ago, I was able to help someone with an appeal on an MSP application. And we won that case. So it was pretty cool. I've never had to delve that deep since then, but every time I see her, she always uses the phrase, she'll introduce me and she'll say, "You saved me." And so when I get those people who thank me, it just makes everything worthwhile. So, yeah, I could talk all day about cases, but Donna won't let me. So.
So, yeah. And just a little bit. So you're at Harrison County Community Services. So you kind of have your fingers in everything down there.
Yes. Yeah, we do a little bit of everything and help people with anything basically that can help their life be improved. And SHIP is just part of that big picture. So, yeah.
Well, thank you for joining me today.
Thank you.
We'll try to stay
Thanks
out
for
of trouble.
asking.
We'll stay out of trouble now. Back to Susan.
No, I don't want to stay out of trouble.
Right. So, good trouble and all that. Okay. Well, thank you, Kim, and thank you, Donna. And now we're going to turn it over to Megan, who's going to introduce us to two of her special counselors.
Thank you, Susan. And Nancy and Kim, we are soulmates. I love the complicated client situations. They are so rewarding. You're digging through everything, trying to make sense of everything. I had one last week. It was 2 hours. It had to be translated because it was a Spanish speaker gentleman, and he pulled out about 7 different insurance cards, and I just loved it. So Kim and Nancy, I get it. Those are very rewarding, the complicated ones. All right, so I have 2 counselors this morning with us. I have Bob and I have Joan. Joan, let's start with you. I don't see Joan on my cameras, but I know she's here. Morning, Joan.
Hi, good morning. I'm here.
All right, so Joan is in Lake County. Joan is a newer counselor. She's still going through mentoring, so she doesn't have a lot of real in-depth client stories, but I do have some questions for Joan. Joan, what got you interested in being a SHIP counselor?
When I relocated to Northwest Indiana, I was looking for a volunteer activity that would blend nicely with my own personal work experience. I had been a healthcare executive for a number of years, and as a result of that, understood the complexity associated with federally funded programs like Medicare and Medicaid. Also, my nursing background before going into that executive position endeared me to the complexity and how difficult it is for really elderly patients to understand. Oh, I'm sorry, not patient clients, to understand again the complexity. And for me, the greatest joy is knowing that I have the potential to really eliminate and or reduce anxiety associated with deciding what program is out there for me. Secondary gain, I'm 83 and I was interested in making sure that my brain cells continue to function, which absolutely the training associated with this credentialing process is intense, but I would tell those of you future interested, it's extremely worthwhile. I also live in a retirement community. So even though I've not been able to fill out any paperwork, great opportunity just to gently talk to staff, open enrollment, Advantage plans, the gives, the no, and the yes associated with that particular plan, and cautioning them, please don't click renew without really double checking. Again, making sure. And I have found out since then, for sure, some of the residents, the perks that they got with the Advantage plan have disappeared. So that, and it's all of this has been really very rewarding. Happy to be a part of and look forward to continuing working directly with clients.
Thank you, Joan.
You're welcome.
That's just wonderful. You can tell that you have a passion for helping people, and we're so glad that you picked SHIP as your outlet. And again, I know you haven't had many official client appointments yet. Through some emails that you and I sent last week, you mentioned helping out a resident with their Medicare. And without giving names, would you like to kind of share that story?
Sure. Wasn't terribly complex. Again, she's one of our residents, and I'm involved with the landscaping committee, and she is a member. And she had indicated that she was turning officially 65, but that she was also on disability. And I knew enough, right, that we ought to get an appointment with the Social Security office. I assisted her in doing that because at least in this area, access to Social Security offices are limited, but if you make an appointment, works much better. I did that on her behalf. We got an appointment about 2 weeks later. I put her in my car and off we went to the Social Security office. I sat with her. They're quite on time, which was the good news, and sat with her while she was in front of the Social Security employee. It took less than 10 minutes, but she left again, realizing not a big deal. Thanks, Joan. Now I'm ready to go. So that was my first experience.
Wonderful.
Yeah.
And I love your hands-on approach. You put her in your car and you drove down to Social Security. So
Yeah.
And then when she gets her Medicare card, we can talk to her about her other options.
Correct. And
Yep.
she may fall into those categories without divulging too much. I'm not
Mhm.
certain of her, income. And given that, unfortunately, the more recent information from you about lowering the income levels
Mhm.
for some of those programs. But that would be my next step with her.
Yep.
Well, informally,
Yes.
unless I can get her to agree. I have noticed the residents here are somewhat reluctant to pursue external assistance. I'm trying to break down that barrier. They tend to think that we might be brokers.
Oh, yeah,
And I
yeah,
have to gently peel that onion away so they understand that it's not.
exactly,
Yeah.
exactly. Um, and we've talked too in the past about me coming out and us doing a presentation at that retirement center, which I know is kind of, we're waiting on some things, but
But I would tell you their greatest need is the drug plan.
yeah.
Many of them take a significant amount of drugs. So the
Mhm.
plan D and finding a plan that works for them could be extremely helpful.
Yeah. Well, thank you, Joan. Anything else you would like to share or add?
I wish all of you the very best. Continue helping us seniors out.
Thank you, Joan. All right, let's bring up Bob. Hi, Bob.
Hello, how are you?
Bob, good. How are you?
I'm okay.
Good. Well, thank you for joining us this morning. Bob lives in Valpo in Porter County, and he will be at the Porter Council on Aging. And Bob is actually still in training with us. Bob will finish his last day of training this week. I think it Thursday, Bob? I think it's Thursday.
Yes,
Yes.
it's Thursday.
So again, Bob hasn't seen any client appointments, but Bob is on Medicare himself. And so he's got some stories there I believe he's going to share briefly. But first, Bob, tell us what brought you to being a SHIP counselor.
I went on disability several years before I was 65, and the human resource person pointed me towards SHIP, and I got some help there and got on a plan as I moved off of Cobra. And so they helped me maneuver through that and know how long I could stay on each one. So it helped quite a lot. And then later, when I turned 65, I went back and got help about changing, because when I was on disability in Indiana, you only could have an Advantage plan. You didn't have an option of Medigap. So, and actually, I thought I was just going to stay on it and hit renew, as somebody said. And then they explained the difference to me, and we kind of went over that scenario that you gave where people had a lot of money on this bill and how much you pay for each thing. And so that kind of really opened my eyes. So when I wanted to look for volunteer work, I kind of thought a lot about that, and I wanted to help other seniors who come along behind me and pass it on. You know, I'm kind of a pass it on person. If someone was good to you, that means that you've got a token that you got to pass on to somebody to be good to them. And so I wanted to be able to help people, and I kind of like that idea. So I'm looking forward to it.
Wonderful, Bob. And I know when we talked, when we did your kind of little pre-counselor interview, you mentioned that you were watching some of our Facebook Lives.
Yes.
And you mentioned something about how we explained, I think it was Advantage plans and Medigaps.
Yes.
Do you want to speak on to that, or kind of like what you saw in those lives that you really liked about the possibility of being a SHIP counselor?
Well, I like the level of detail that you would go into, because it was enough to make you realize that there's a lot more to it than what appears on the surface. But in those videos, you don't bog down too much data to where people's
Mhm.
eyes roll back in their head and they think I'm never going to understand this because it's too complicated.
Mhm.
And you really strike a nice balance of that. And like I said, when I first went on, I didn't have a choice. But later, when I saw I did, it really opened my eyes to the great differences.
Mhm.
And
Mhm.
then it's even a lot of differences just between the different Medigap plans, you know, A and B. I mean, plans A and G and D and stuff. So I liked how you did that because I was a data analyst in my previous life. And so I can get very granular. And sometimes it's bad, you know, you got to watch when you're talking to humans and you're not talking to a machine, you have to realize that they have a point at which they short circuit. They can't do any more of that. And I really like the way you guys did the videos. It's really good about, you get people interested, you get them to realize
Mhm.
there's a lot to learn, but it's not overwhelming.
Exactly. Yes.
Yeah.
Yes. Bob, what else do you want to share?
Well, so like I said, I was on disability and I thought I was going to just hit renew and stay on this Advantage
Mhm.
plan. And the ship counselor explained it to me using that example that you were using about, you know, if you have a bill that's $70,000 or something, then here's how much you pay if you're paying out this out of pocket. And if you're on certain plans, then you can pay next to nothing or a small amount. And I, so I finally understood about how, depending on your health level,
Mhm.
because I was on disability, so I had health problems. And so you need a different kind of insurance than someone who hasn't seen a doctor in 36 years. And it's quite different. So I trusted him. I went with him and I got on the Advantage plan. I took plan G. And a year and a half later, somewhere in between there, I needed a couple of stints.
Mhm.
And so I was going to go to the hospital and do the outpatient procedure that they do, and you're out, you know, you're home in 8 hours. So 8 hours later, they wheeled me down to ICU because I ended up needing 3 stents, not two.
Mm.
And the first two they did were so calcified that they couldn't get to the third one. You can only have that dye in your system so long because your kidneys will fail. So I couldn't go home and I couldn't finish. So I went from being an outpatient to an inpatient in ICU. And then I had to wait 2 days to go back to being an outpatient back on the table to get the third one. So I saw the bill when it came through, and the bill before any of the deductions or any of the stuff they do, the bill was about 200,000.
Wow.
I know, and because I was on Plan G, the only thing I ever paid was my monthly premiums.
That's awesome.
And yeah, and I'm gonna share that story with people when they
Mhm.
ask, because I think one of the things I want to make sure people understand is that it partially depends on your health today, but you also have to look at the future, because there's not too many people who tell me, well, yeah, I got some health problems now, but I got way better when I turned 70.
Exactly.
So yeah, that's not going to happen a whole lot. So I'm going to try to make sure they understand that. And I'll use my story as an example.
Mhm.
And hopefully I'll get a little bit smoother at it as I go on. I'm intimidated by you guys. You got like 180 years of
Oh.
experience. And I'm on day 3 of training, trying to figure out what the heck I'm doing. So, you know, but the one thing I like, the lady said that she didn't tell her what to do. She told her where to go
Yeah.
for the help. And I really like that, because one of my favorite things is to tell people where to go. So,
Mhm.
so I'm gonna enjoy it though. I'm looking
Yes.
forward to it. I think
Yes.
it'll be a lot of fun.
Yeah. Yeah. Well, thank you for sharing that story, Bob. And I think that your background as being on Medicare really helps clients, because you can share insider information. You know, you've learned firsthand how it works and see how it works. And while we have to remain impartial, a big piece of what we do as ship counselors is education. And by sharing your story and your experiences as being on Medicare, you're educating.
Right.
So thank you, Bob, for joining us. Thank you, Joan, for joining us. Susan, do we have any questions in the chat box?
Not that I am able to see at this point.
All right. Does anyone else want to share anything else?
Hey, Megan, maybe,
Yes.
because generally we might know, but if somebody wants to become a ship counselor, how would they go about doing that?
Thank you, Sean. That's an amazing question. So Susan, would you like to answer that or do you want me to?
Oh, I can do that.
All right.
Well, there's a couple of steps. First of all, I always encourage people to visit our website, which is easy to remember, medicare.in.gov, like IN like Indiana. And you can find out all kinds of Medicare information, but you can also learn about Indiana SHIP and where we are in the state. We have about 100 locations and always looking to grow those. And find out about our program. There's also a tab there for a volunteer application. And once you complete that application, then you will be connected with the appropriate area supervisor, like Donna, Sean, Megan, and then we have a couple of other people too. Judy, Jeff, and Bruce are also volunteer supervisors for other parts of the state. And then that person will reach out to you and just have a chat to make sure that you get your questions answered, kind of talk to you about a day in the life of a ship counselor. And, kind of go back and forth about if you think it would be a good fit and you would like to pursue it. And then you'll be scheduled for training and get all kinds of materials. Of course, we do a background check to make sure that, there's no felons among us. And then, you're kind of on your own after a pretty significant mentoring process where you work with an experienced counselor for a while. And then when you're ready to go on your own, then you are assigned to a site and we make sure you understand what you need to understand and meet all the other terrific ship counselors around. And, that's another point about being a ship counselor. We're never really alone. We might be in a site with only one or two other counselors in a location, but we are just a phone call away. And I know I regularly call my coworkers and ship counselors around the state when I've forgotten something or just need help with clarification. So it's truly a rewarding experience. And I think everybody should be a ship counselor if you have time and you like to help people. But check out our website, medicare.in.gov. There's an application there, or you can reach out to any one of us. If you call our central office at our toll-free number, which Megan can put in the chat, then we can link you up with your area supervisor and get that conversation going even before you fill out an application. I think that's about the routines.
Yep, that's perfect. And I did get that phone number in the chat box for
Thank you.
everyone. All right, so let me share my slide or my screen and we're going to look to see what we have coming up in March. But before we talk about March, let's talk about what we have left in February. I got ahead of myself. Susan, I'm sharing the next month's information. We will be back February the 11th this Wednesday to talk about our love for our ship sites. So we will have a couple ship sites on to share why they joined ship as a partner and what they enjoy about it. At the end of February, on February the 23rd, we are going to introduce you to our call center. So Susan will go around our call center office in Indy and introduce you to the individuals that answer the phones when you call that number I put in the chat box. And then in March here, you can see that on March the 9th, we will be talking about Medicare and medication costs. So different ways besides your Medicare on how to afford your medications. On March the 11th, we're going to do our What to Know Wednesday, and Susan is going to give us the updates for the Medicare Savings Program and Extra Help. And then we're going to wrap up March on the 23rd with Juan Manuel, who's going to share the Medicare Savings Program and Extra Help information in Spanish for everyone. We also have one more Facebook Live this week on Thursday, the 12th at noon. That's our Lunch and Learn that Susan and I have started. And we are going to be talking about different Medicare options when you're on Medicare to help lower your costs. So the supplements and the Advantage plans, kind of along the lines that Bob talked to us about. So that's what we have coming up. So I am going to set our cameras so you can see all of us, and we are going to wave goodbye to you all. Thank you again for joining us. Thank you, counselors, for joining us and sharing what you love about SHIP. See you Wednesday.